Hello friends, I am Dr. Vivek Tank, an endoscopic surgeon based in Ahmedabad. Today we are going to talk about gastroscopy or an upper GI scopy, or what is in layman's term called as the endoscopy. So what is an endoscopic procedure? Basically it is the examination of the pharynx, esophagus, stomach and the first 20 centimeter of the small intestine, that is called the duodenum. A small tube which has a camera at its end is passed through the mouth into the stomach to observe the inner skin or the mucous membrane of the stomach, esophagus and the duodenum. So why do we do this endoscopy? It is basically for two reasons: either to diagnose something or to treat something. So when we do it for the diagnosis of certain disease, like when a patient presents with certain symptoms like dysphagia, vomiting, or there is a suspected disease for which the diagnosis is required and it can be done only through the endoscopy, or there are certain tests which are ordered by a physician or a surgeon and they turn out to be abnormal, and to find out the cause of those abnormal tests and to perform a biopsy for the diagnosis of certain diseases like cancer, we do a diagnostic gastroscopy. Similarly, why do we do gastroscopy for treatment? So certain diseases are treated through endoscopy, like if there is severe bleeding from the ulcer or the gastric varices, or somebody has swallowed a foreign body like a coin. So to remove those foreign bodies, we need to do an endoscopy. Similarly, to dilate a stenosed or a narrowed segment of the esophagus or the duodenum, we need to do the gastroscopy. Also, it is required to perform advanced endoscopic procedures of the third space like ESD, POEM, and also required for the performance of the endoscopic bariatric therapies. So now we have seen that why we should perform the gastroscopy. So now I'll take you through the procedure. What happens before the procedure, what happens during the procedure, and what you should expect after the procedure. So before the procedure, your doctor will ask you to remain nil orally. That is, you should fast for at least 6 to 8 hours depending on the indication for which the gastroscopy is being done. Also, you'll ask to modify certain medications which you have been taking regularly for a long time. Also, you'll be asked to stop the blood thinners which make your blood thin and difficult to coagulate. You will be asked about your allergies and you should inform the doctor in detail about the allergies you are having and the treatment thereof. Then the anesthetist will insert an IV cannula on your right hand and administer certain drugs. You will be given oxygen through a nasal cannula, and there will be vital monitoring of your temperature, pulse rate, blood pressure and oxygen levels. You will be given either a short general anesthetic which will make you fall asleep for a small period of time, say 5 to 10 minutes, or there will be a spray to numb your throat so that you don't experience anything when the procedure is being performed. You will be asked to lay down on your left side, and if there are any ill-fitting or dentures, then they should be removed. So now we will discuss what will happen during the procedure. So during the procedure, the doctor will pass the endoscope through your mouth into the stomach. He will examine the esophagus, the stomach and the duodenum thoroughly and find out what needs to be done. He will also call one of your relatives inside the endoscopy room and show the findings of the procedure to them. All this will happen while you are asleep. After the procedure, you will be asked to stay nil orally, that is not to take anything by mouth for a certain period of time, say 1 hour, and you may experience a little bit of the sore throat. Plus, you may feel a little bit bloated because we have inflated your stomach with air or carbon dioxide. So, but gradually over a period of few hours, you will be perfectly alright. Well, on discharge, you have to take care about certain things. That is, you should not drive for 24 hours, should not operate any heavy machineries for 24 hours. You should not make important decisions or sign important documents for the first 24 hours, and avoid alcohol for the first 24 hours, because you will be under the effect of anesthesia, and all these things may not go well with your recovery. Also, at the time of discharge, the doctor will ask you to start back your medications as and when they are required. Now we'll see how much will be the length of your stay after the procedure. Well, the length of your stay, if we are doing a diagnostic procedure, then you can go home within an hour. But if it is a therapeutic procedure, then the length of your stay will depend upon the complexity of the procedure, any new finding which has been evolved during the examination, or any unexpected outcomes or complications that has occurred during the procedure, and any other medical conditions which require that you should remain in the hospital for some time. The results of the procedure, that is the report of your endoscopy procedure, will be given by the doctor on the same day. However, the biopsy, if he has taken a biopsy, then that biopsy report will take at least 3 to 5 days to come, and the doctor will discuss in detail regarding the biopsy report on your next follow-up. So, what are the risks involved in this procedure? No procedure is totally free of risks and complications, but it depends on your overall health, the complexity of the procedure, as well as the experience of the physician. So always ask your doctor that why are we doing this procedure, what are the risks, and what are the alternatives to this procedure. You should always report back to the hospital after going home if you develop any one of these following conditions, like nausea and vomiting, severe abdominal pain, or bleeding in vomit or stool. So this was everything about the endoscopy you need to know before you go in for a procedure. Do let me know your thoughts and your questions on my YouTube channel.